What's the scariest part of visiting your GP? For a lot of people, it's getting on the scales. GPs nationwide are using the body mass index as a tool for assessing someone's health, and a lot of the time, BMI alone just isn't accurate. Using BMI to assess health is fueling a mental health crisis on body image that, if left unchecked, could become a very serious problem. Research has shown that our body image affects everything from our mood and ability to socialise, right down to impacting motivation and sense of worth. Yet, the measurement we most associate with it isn't really fit for purpose, and to understand why, we need to rewind. In the 1830s, Adolphe Quetelet, a Belgian mathematician who was working on population studies, needed a way to measure the normal man. 130 years ago, we didn't have computers or electronic calculators, so he needed something simple. His solution was known as the Quetelet index. You take a person's weight and divide that by their height squared. From this, that person is assigned a number. If that number falls in a certain range, that person is considered normal. Nowadays, we know this as the body mass index, or BMI. And the formula is still the same. The issue is that it's 2021, and technology has evolved since Quetelet's time. Yet we're still using a system that, according to the latest figures, labels only 34% of the adults in England as normal.
We know the BMI is not a perfect measure of health. And one of the problems, for instance, with BMI is that it can incorrectly classify people as being overweight or underweight. For instance, we know that muscle mass weighs more than fat mass. So if someone is quite athletic and they have a lot of muscle mass, their BMI could appear as being overweight, whereas that person is actually very healthy and they have a healthy weight.
The problem is, Quetelet's formula was designed to be used on European men as part of a population study, not to judge their individual health. It has been argued that in modern society, BMI alone does not accurately judge individual health in ethnic minorities. And its inaccuracy is particularly present in women.
You know, someone like myself, like I'm 5'9", yeah, and someone my age is meant to be 8 stone. That's considered my healthy weight, 8 stone. I can't imagine being 8 stone. Like, I'm like, oh, first of all, where's the weight for my hips on its own? That's 8 stone alone. I think what's important with the BMI is realizing that the system they've chosen to use, it's a very unfair system to judge people on. People's backgrounds affect what their bodies look like.
BMI doesn't account for the different shapes and sizes human beings come in, but it's still used as a primary tool for doctors to assess a person's health. This is where BMI is doing a lot of harm.
I think that, being a man who's had eating problems, I've always been seen as this number, and it's never been an accurate reflection of my whole health. I was obviously not very well. I was unhealthy, but when I was a normal weight, after gaining weight from an eating disorder, I still wasn't feeling healthy. In my mental health, I was really struggling, but because my BMI was normal, I was told that I was healthy again. And so it just shows that it's a really crude measure of health.
We know that right now across the country, people with eating disorders are not accessing the right treatment, the right support, and are often turned away from services unless they fit neatly into an underweight BMI bracket. But actually, eating disorders aren't about BMI, they're not about weight, they're not about looking a certain size or a certain shape, but they're extremely serious and extremely complicated mental illnesses. And every single time we judge someone on the BMI, it puts this whole worth into that number on the scales without looking at the whole picture of that individual.
Weight-based discrimination is becoming a troubling issue in healthcare, the effects of which aren't limited to those who need help with an eating disorder. Every day, patients report symptoms to their GPs that are being ignored because of the fixation on their BMI, leaving people with undiagnosed illnesses being told they just need to lose or gain some weight.
We do know that BMI is just such an outdated, sexist kind of way of measuring things. And it really baffles me that we still use it actually and judge someone based solely on that.
BMI is broken. We need a system in place that can accurately evaluate someone's general health and stop people facing weight-based discrimination when looking for medical help.
People can be very healthy and be out of that normal range of BMI, and it doesn't take into account loads of things about somebody's individual life. And actually, if we're going to talk about individual health, we need to look at the whole picture of an individual rather than just a very generic scale.
Because of BMI, 66% of adults in England are being told they are not normal. Judging people by BMI alone is fueling this mental health crisis on body image. Here at the Women and Equalities Committee, we've been researching the body image crisis and the factors that are fueling it. We've only scratched the surface with the causes of this crisis with what we've covered in this video. This research has been carried out as part of our inquiry, Changing the Perfect Picture, in which we cover even more about what can be done to fix body image concerns in modern society. For a more in-depth look at our research, you can read our report summary available here. Or if you'd like to read our full report, you can at committees.parliament.uk. As part of our report, we've made 17 recommendations to government. We're eager to hear the government's response, which, as a House of Commons committee, they're required to provide.